Welcome to the Scott Townsend Show, brought to you by Dietzo Man Productions.
Hey, this is Scott Townsend. Thanks for joining the Scott Townsend Show. And today I have with me a special guest, a returning guest, Dr. Joshua Gentges. He's the research director and director of evidence-based practice, an associate professor in the Department of Emergency Medicine at OU's School of Medicine, Community Medicine at Hillcrest Medical Center. Welcome to the show, Dr. Gentges.
Hi, Scott. It's nice to talk to you again.
Yeah, we really had some good feedback on the last show that we had, and I was glad to hear that you were interested in doing another one. Last time we talked about masks, and if you missed that show and you want to watch or listen to it again, I'll post a link in the show notes below, and I'll put a little picture of it down here below us. Today, there's a lot of talk about vaccines now, vaccinations. We've got past the mask. Well, I don't think we have gotten past the mask thing. I got a question here we'll talk about. But I'm really glad you're here because I know nothing about any of this. And so Dr. Gentges is going to bail me out here and help me smash some rumors, hopefully, and give people good information about vaccinations. And so here we go. Are you ready for the, this is almost like Jeopardy or something like that? We'll ask questions and you just have at it.
Absolutely. Fire away.
All right. So the first question I have here is, and I don't know what this term means. I've heard there are mRNA vaccines. What does that mean, and how do they work?
That's a really good question, and the simple answer is your cells in your body use mRNA to make proteins, and so those proteins kind of help your body do all of its work. Well, in this case, the vaccine introduces a piece of mRNA into your system, and your body then uses that to make a protein that is part of what they call the spike protein that the virus uses to insert itself into your cells. Once your body can recognize that spike protein, it can then fight it, and it can prevent you from getting infected with the virus. mRNA naturally breaks down within your system in a matter of hours, and there's no way for your body to make any new mRNA. Just what they injected into you, that's all that happens, and then it goes away on its own.
Okay. Second question. This came from Facebook. Denise asks, do you think it is safe for people who take biological injections for RA, psoriatic arthritis, etc.? I don't know what RA is, but...
So I think that those kind of decisions on whether or not you should get the vaccination if you're immunocompromised in general are decisions you should make with your physician. However, I would say that for most patients who have RA or are on some kind of immune modulating drug or have some other reason for their immune system to be depressed, they are at much higher risk from contracting COVID and becoming ill than they would be from getting ill from the vaccine. It's possible that they would have a greater kind of side effect profile from getting the vaccine than people who are not compromised in their immune system, or they might have a smaller side effect profile. But when it comes to these mRNA vaccines, they seem to be pretty safe and effective. And so most patients who have immune compromise, the CDC is recommending that they get the vaccine. In fact, they tend to be either in tier 1 or tier 2 of vaccine distribution plans.
That brings up a good question. Everything that we talk about on the show today, I'm not a doctor, so don't call me or ask me any medical questions. And with everything that we say on the show today, wouldn't you say you need to bounce this off your physician?
I think that when people have questions about getting the vaccine or things like that, if they can contact their physician, that's always a great option for them to do. Another local kind of resources for people would be through their local health department. At least in Tulsa County, and I think this is the case in Washington County too, The local health department is coordinating the vaccination of people through the county. So they know all about these vaccines, and they're very good at answering those types of questions if people have a specific concern. But the take-home message for these vaccines, especially the Moderna and Pfizer vaccines, is that they seem to be very, very safe, and they're 95% effective at preventing severe COVID-19 disease.
I heard yesterday on the radio, so I'll run this by you. I heard that Johnson & Johnson has a new one out that's 66%. Does that mean that I would rather take Pfizer or Moderna versus Johnson & Johnson?
I think for most people, you'd rather get whichever one you can get first. That's, to me, the thing that would be most important. The different levels of efficacy between the vaccines, those are preliminary data. I don't think that we know necessarily which ones are going to, for example, last longer or have better long-term outcomes, those kind of things. So to me, any vaccine that's made it through the FDA's approval process is one that I think that people should have confidence in taking.
Okay. Next question here is the second dose the same as the first or different?
It is the same in both the Pfizer and Moderna vaccines. It's just the same vaccination that you get. It's just an extra bit to kind of get your body to really do a good job of fighting the virus if it comes in contact with it.
Okay. Should a pregnant woman take the vaccine or not?
This is a really good question, and I'm not certain that anybody knows the answer strictly. The reason is that when it comes to pregnant women and breastfeeding women, the clinical trials that were performed did not include those particular populations. So far in post-vaccination kind of safety data, it doesn't look like there's been significant problems with either pregnant women or breastfeeding women, and it's likely that these vaccines are safe in those populations, but we just don't have complete data. I will say that the American College of Obstetricians and Gynecologists is recommending that patients who want the vaccine, who are pregnant or breastfeeding, should be able to obtain it.
Okay. Let's see. No, here's another one. Once vaccinated, can you still transmit the virus?
It's likely that transmission is greatly reduced by getting the vaccination, because these vaccines don't use any live virus. They're just a little piece of the protein that the virus uses. So since there's no live virus and there's not really risk of getting the virus if you get the vaccination, it stands to reason that if you don't get infected, you're likely to cause less transmission. But the actual primary clinical trials on that have not yet been conducted. And so out of an overabundance of caution, the CDC is still recommending that if you have had the vaccination, until community levels have fallen of transmission of the virus, or until we have enough vaccination performed throughout your local area to achieve herd immunity, that we still recommend masking and social distancing at that point.
Even after you've got the vaccination? Even
after you've gotten the vaccination. Now, the CDC does say that if you are in a group, like a cohort of people where everyone has received both vaccinations and are past the 10-day to 2-week waiting period, that you should be able to congregate with that group reasonably safely, just because the transmission rates will have fallen so low within that group.
This is just me thinking, but I almost want to put like a armband on my arm once I get vaccinated, so that people will know, hey, that guy's been vaccinated, but
that it's happened for you.
Yeah. But then that wouldn't stop people from doing it who hadn't got vaccinated. And
I worry too about people who end up having, fear of missing out, and I think too that from a privacy standpoint, my personal preference would be just to do what I'm supposed to do in public and just go on with my life. I've been vaccinated. I got both vaccines at this point. So, but I'm still social distancing and still masking in public.
How was that experience for you? I mean, did you side effects or any kind of?
So it's a good question. The side effect profile ranges from people have no symptoms at all to, a mild sore arm for 12 hours or a day or so, which was what my experience was. But some people get, fairly high fever and chills and, maybe a slight cough, body aches, headache. They get basically what are symptoms of mild COVID disease. But like I said earlier, since that mRNA breaks down in your cells naturally, these symptoms don't really last for more than a day, and then they go away on their own.
Okay. Can you get one shot from Pfizer and the second from Moderna?
So it's preferred that you don't, and the reason is that the vaccines were developed differently. They they don't necessarily use the same mechanisms and the same protein and things like that. And no trials were performed, looking at, for example, getting the Pfizer one first and then the Moderna one next. That being said, in a pinch, if there's no other choice for your second vaccination, it's okay to get, the Pfizer one first and then the Moderna one second. It's not preferred, but it's okay. We think that it probably would improve the level of immunity to severe disease that you would have. The problem is we don't know how much.
So when I get my first vaccination, how long is it before I get my second one?
So in general, 2 weeks is the time period you'll get. You'll get a little card. It comes from the CDC. It's just a little paper card, and it'll have the vaccine that you received and what lot the vaccine was in, in case there's a contaminated lot or if there's a problem with, how well the refrigeration worked or something that they can contact you. The chances of that, by the way, are vanishingly low. But it'll also say on the card what your date is for your second vaccination. It's okay to flex that a little bit. Like, it doesn't have to be exactly 2 weeks after or exactly 14 days after or whatever. You can flex by, days to weeks, and you still have improved immunity from the second shot.
Okay, cool. The next one here. Will I have to get another shot next year?
That's a good question, and nobody knows the answer. We've only had this disease in the United States for roughly a year, and we've had access to vaccinations for less than 2 months. And during that period of time, we're kind of trying to learn and get new information about it. It is likely that the coronavirus will not mutate as rapidly as the flu virus does, for example. So finding, brand new vaccines to fight it probably won't be as necessary as has been with the flu. But the other reason why you have to get a flu shot every year is that our bodies don't remember the flu virus for long periods of time. And we don't know if that is the case for the coronavirus or not. It's possible that booster shots might end up being necessary on a time period anywhere from, several months to, once every several years, or not at all. We're just not certain yet.
Okay.
If you look at a virus like the mumps, for example, a shot for the mumps when you're a kid protects you until you're an adult and probably until fairly late adulthood. But a flu shot you have to get every year. We don't know where it falls within those two parameters.
You said something a while ago about the vaccination not having a piece of the virus. Does that, so flu vaccines, do they have a piece of the virus in there and this one doesn't?
Right, depending on the type of virus. This is actually a completely new vaccine. Before COVID-19 came, no mRNA vaccinations were being performed in the United States. And most of the older vaccines either use like a piece of the actual viral particle, or they might use a virus that's been attenuated. That's how flu vaccines work. So a flu vaccine is the flu virus, but it's been modified so that it can only survive basically in your nasal cavity. So it doesn't infect you systemically. It gets in your nasal cavity, your body makes antibodies to it, and then you can fight it afterwards.
Okay.
But since this one's completely novel, it just uses a technique that transcribes some of that mRNA from the virus. It like takes that, and then we make more of it in a factory, and then we just package up that little piece of mRNA and use it as use it as a way for your body to recognize the virus when it comes forward.
Okay. Is the coronavirus going to mutate like the common flu? I think you just answered that.
It will mutate. All viruses mutate. Whether or not it mutates to the extent that the flu virus has mutated over the decades is unknown.
If I get the coronavirus, would help me to get the vaccine to fight off the virus? If I get the coronavirus, would it help me to get the vaccine to fight off the virus?
Yes. So we're recommending now that if you've had a bout of COVID-19, that you still get the vaccination whenever your tier comes up. The caveat there is that you should not receive the vaccine within 90 days of having coronavirus. So if you've had coronavirus, 3 months after that is when you would be eligible for the vaccination.
Bonus question. This is one of the rumors that I saw that I hope you can, I'm sure you're going to be able to knock this one out of the park. Is wearing a mask dangerous?
Nope. So it turns out that various types of masks are effective for preventing transmission of the coronavirus, and none of them are dangerous to wear. Just anecdotally, I wear either an N95 or a surgical mask or both between 10 and 12 hours a day, most of the days of the week whenever I'm working clinically, and I've had no ill effects from it. It doesn't reduce your oxygenation levels. There's no evidence that people have increased levels of respiratory illness whenever they wear a mask. Masks are safe to wear.
Someone said that it was a petri dish of. I guess if you wear the same mask without cleaning it or something, that.
Sure. It would be like if you wear any type of clothing,
Yeah,
day after day after day, without putting it in the washer, that would of course be a problem.
Yeah.
But any piece of clothing that, we don't freak out about wearing a hat, for example, or our socks or gloves. There's no difference between wearing those things and wearing a mask. So, calling it a petri dish, there are types of bacteria and viruses on our skin at all times. So the mask does not have any effect on whether or not those things are already living on your skin. You don't have any choice or effect on that. And masking is safe.
So, is there anything else you'd like to say, or those are my questions for now. I'm sure we may have to do this again. There might be more questions. I'm sure there will be.
What I'd like to say is that we have the chance now to turn the corner. We have the chance to turn the corner on this. We're starting to see some reduced numbers around the state of total numbers of new cases of coronavirus. Positivity rates are starting to move in the right direction, but we still have completely full hospitals, and we still have an unacceptable number of infections and deaths around the state. So I would plead with people that they please follow recommendations, that they wear their mask whenever they're in public, that they social distance whenever it's possible, that they stay at home if they have the opportunity to do so, until we get enough shots in arms to really start meaningfully reducing transmission levels.
I'd also like to say a big hat tip to Kelly Williams, the city with the city of Bartlesville, with their Beeville Bill and the campaign to help kick COVID to the curb, so to speak. And in full disclosure, I'm a part of that committee that helped design the campaign. But I really appreciate your support on that and helping us all, work together and applying your knowledge and expertise
I'm
so
glad.
that we can hopefully get this thing taken care of sooner than later.
I really do think we have a good chance by, I think by summertime, where we can have a lot of return to normal activities and kind of get things back to normal. That's kind of our goal in the state, and it's the CDC's goal as well.
Well, Dr. Gentges, thanks for your time once again. As always, it's a pleasure to have you. It's an honor to have you here and share your knowledge and expertise with us. And much luck to you and what you're doing down there in Tulsa. If you have any more questions, you can send me an email, scotttownsend2400@gmail.com, and I'll pass them along to Dr. Gentges, or we may even have to have another show where we answer some more questions if there are any that come up. And who knows, this thing is such in flux, there may something come up, nationally that, it's been kind of one of those deals. So yeah, if you like the podcast, if you like the show, like, subscribe, tell your friends, write a review. But yeah, and if you want to listen to the show on your smart speaker, just say the Scott Townsend Show with Alexa, and she'll start playing the show. But anyway, for Dr. Gentges, this is Scott Townsend. Thanks for watching and listening to the Scott Townsend Show, and we'll talk to you later.
The Scott Townsend Show is a Dietzo-Man production. For more episodes, visit the Scott Townsend Show YouTube channel, listen on Apple Podcasts, or wherever you listen to your favorite shows.